Let's talk about something most people won't, but should. Yes, even in your 60s, 70s, or beyond, you still have needs. Masturbation is normal, natural, and even healthy at this age. But there's a right way and a wrong way, and certain mistakes, especially as your body changes, can quietly harm your heart, your hormones, even your prostate. This isn't about shame. It's about wisdom. Let's talk, openly and honestly, about what not to do when you pleasure yourself in your later years. If this video made you feel seen, not judged, subscribe. We're building a respectful, mature space for real conversations about aging and health. Leave a comment if you have questions. You're not alone, and you deserve answers. Rushing through masturbation or forcing orgasm may not seem dangerous, but for older adults, especially those over 60 with heart concerns or circulation issues, it can quietly put real strain on the body. As we age, the cardiovascular system doesn't respond to pressure the way it once did. Sudden spikes in heart rate, blood pressure, or tension can be harder to recover from, and in some cases, even risky. Doctors have long compared sexual activity in older adults to mild physical exercise. That includes masturbation. If you rush, pushing your body toward climax with force or urgency, you're asking your heart to perform like it did at 25. But your heart now may be managing high blood pressure, arrhythmia, or reduced elasticity in your arteries. When you overexert it, even briefly, you can experience chest tightness, shortness of breath, lightheadedness, or fatigue. These aren't just signs of aging, they're warnings. Beyond the heart, circulation matters too. Erections and orgasms are both blood flow-driven processes. If you have diabetes, prostate issues, or take medications that affect circulation, the body may need more time to respond. Rushing increases friction, tension, and physical stress. This can lead to swelling, discomfort, or a sense of frustration that builds more anxiety over time. It becomes less about pleasure and more about performance. That mindset causes harm. Some experts encourage seniors to approach masturbation the way they would a gentle walk or yoga. It should be unrushed, intentional, and responsive to how your body feels in the moment. Taking your time supports healthy circulation, helps regulate breathing, and reduces strain on your nervous system. Orgasm doesn't need to be the goal every time. Sensation, relaxation, and comfort are just as valuable. The psychological part matters too. Forcing orgasm often comes from an outdated belief that climax equals success. But in older age, success looks different. It's about presence, peace, and body awareness. Many seniors report deeper satisfaction when they stop chasing a finish line and instead focus on what feels good, emotionally and physically. If you notice discomfort, pressure in your chest, or lingering fatigue after masturbation, don't ignore it. These can be signs that you're pushing too hard. Talk with a doctor, especially if you have a history of cardiac issues or prostate problems. They can help you understand what's safe and what adjustments may help. In short, masturbation isn't something to stop, but it is something to slow down. Your body is wiser now. It deserves patience, respect, and care. Treat it that way, and you'll not only protect your health, you'll likely rediscover a more meaningful form of pleasure. Watching pornography that leaves you feeling guilty, anxious, or emotionally unsettled isn't harmless, especially in your later years. While sexual curiosity is natural at any age, the emotional response that follows matters more than ever. After 60, your emotional well-being is closely tied to your physical health, and when sexual habits bring stress instead of comfort, the damage can quietly build. Some seniors turn to explicit material for stimulation, but not all content is created equal. If what you're watching creates shame, regret, or confusion afterward, it's not serving you. That emotional weight doesn't just stay in your mind, it affects your body. Guilt can raise cortisol levels, disrupt sleep, and lower testosterone, all of which have ripple effects on your mood, energy, and even your prostate health. Over time, repeated emotional distress tied to sexual activity can dampen your desire entirely or make intimacy feel like a source of stress instead of peace. Doctors and mental health professionals have noted that sexual anxiety in older adults is real but rarely talked about. Some of it stems from the material people consume. Porn that doesn't align with your values or comfort level can distort your expectations, stir unresolved emotions, or create a sense of disconnection from your own body. This dissonance between what you're watching and how you feel afterward can quietly feed depression, lower self-esteem, or contribute to obsessive behaviors that leave you feeling out of control. There's also the risk of desensitization. Just like any form of overstimulation, certain types of porn can rewire your brain's reward system. Over time, you may find it harder to feel satisfied by real-life touch or imagination. This can lead to frustration, dependence on more extreme content, or even a lack of interest in connection with others, not out of preference but from burnout. And at this stage in life, when clarity, confidence, and calm are more important than ever, that trade-off simply isn't worth it. If you're going to engage with sexual material, choose it with care. Ask yourself how it leaves you feeling afterward. Calm, relaxed, comfortable in your skin, or tense, ashamed, or confused? The answer is your guide. Your sexual health should support your peace, not steal from it. And if you're dealing with guilt from religious beliefs, past trauma, or social conditioning, know this: you're not alone. Many men in their 60s, 70s, and beyond carry emotional scars tied to sexuality. Talking with a counselor, therapist, or even a doctor you trust can help bring clarity and healing. At this age, pleasure should nourish, not harm. What you allow into your mind affects your body. Protect both and let peace, and not pressure, guide you. If you feel discomfort, pressure, or any unusual pain during or after masturbation, don't brush it off. This isn't just normal aging. It could be your body signaling that something isn't right, and ignoring it can lead to serious consequences. At this stage in life, listening to your body isn't just wise, it's essential. Many men in their 60s and 70s experience changes in sexual function, but pain is not something to dismiss. Pain or pressure in the pelvic area during climax, a burning sensation when urinating afterward, or a feeling of swelling near the base of the penis or behind the scrotum could point to several possible issues. These include prostatitis, inflammation of the prostate, BPH, benign prostatic hyperplasia, or in more serious cases, early signs of prostate cancer. Doctors warn that too many men delay getting help because they assume discomfort is just part of getting older. But prostate-related pain during ejaculation or urination is never just aging. It's your body asking for attention. Prostatitis, for example, can cause painful orgasms, frequent urges to urinate, or a dull ache in the lower back or groin. Left untreated, it can become chronic and difficult to manage. And while BPH is common, its symptoms, such as difficulty starting or stopping urination, weak flow, or feeling like the bladder isn't fully empty, can severely affect quality of life and worsen without care. In more serious cases, persistent pain or pressure may be one of the early signs of prostate cancer. While not always the case, any recurring or unexplained discomfort during sexual activity warrants a conversation with a healthcare provider. Early detection makes a significant difference in treatment options and outcomes. Masturbation can be a helpful, healthy part of maintaining sexual wellness, but it should never hurt. If you feel tension in your abdomen, burning during urination, or fatigue after climax that feels abnormal, your body is communicating something, and it deserves to be heard. Ignoring pain or discomfort doesn't make it go away. It lets problems grow silently. Don't be embarrassed to bring this up with a doctor. These are common concerns, and physicians are trained to handle them with professionalism and care. In many cases, simple treatments or lifestyle changes can bring relief. Your health, including your sexual health, matters at every age. Pain is not weakness, it's information. The sooner you listen, the sooner you protect your long-term well-being. Your body has been with you for decades. When it speaks, respect it. As men age, it's natural for the body and sexual experiences to change. Some may notice quicker ejaculation or heightened sensitivity, and in an attempt to fix it, reach for desensitizing creams or whatever is within arm's reach for lubrication. But this can be a risky move, especially in your 60s, 70s, and beyond. Using numbing creams or household items like lotions, oils, or soaps as lubricants may seem like a quick solution. But the reality is, these products were never made for use on the sensitive tissues of the genitals. And as you age, your skin, especially in the genital area, becomes thinner, drier, and more prone to irritation or tearing. Desensitizing creams often contain strong chemicals like benzocaine or lidocaine. These can dull sensation, yes, but they can also cause burning, inflammation, and even allergic reactions. Worse, they might mask early warning signs of pain or discomfort during masturbation, allowing underlying conditions like prostatitis or micro-tears in the skin to go unnoticed. Even more concerning is the use of household lubricants, petroleum jelly, body lotion, cooking oils. These are not sterile, and they can clog pores, upset the natural pH of the urethra, and invite bacteria. That's a fast track to infections like urethritis or even UTIs, which become harder to bounce back from in later years. Here's the truth. Protecting your skin and your prostate means being choosy. The safest option? Use high-quality, water-based lubricants made specifically for genital use. Look for products labeled glycerin-free and paraben-free if you're prone to irritation. These are designed to work with the body, not against it, offering moisture without disrupting your skin's delicate balance. Also, be gentle. As testosterone levels decrease and blood flow changes, the skin can lose elasticity and resilience. Don't be rough. Avoid extended friction without proper lubrication. It's not about performance. It's about care. Some men also turn to numbing agents due to anxiety over performance or fear of finishing too soon. But the better solution here isn't chemicals, it's mindset. Self-pleasure at this age should be about connection, not control. Let go of pressure. Focus on presence, not performance. That shift alone can help you enjoy the moment without needing tricks or tools that hurt more than they help. Bottom line, your skin, your health, and your pleasure deserve respect, not shortcuts. You've earned the right to treat your body with care. Choose safe products, be mindful, and never risk long-term well-being for short-term results. At this stage in life, you've earned the right to live with honesty, and that includes your sexuality. But many older adults still treat masturbation like a dirty secret. They never talk about it. They feel embarrassed even thinking about it. And so they hide and suffer silently. Here's the problem. Shame creates isolation. And isolation, especially as we age, is dangerous. Studies show that seniors who feel emotionally or socially isolated face a higher risk of depression, anxiety, cognitive decline, and even heart disease. When you add sexual shame to that mix, the emotional burden can become overwhelming. Sexuality doesn't retire just because you do. It changes, yes, but it doesn't disappear. Your desire for touch, for comfort, for pleasure is human, not something to hide. When you suppress those natural feelings or label them as inappropriate for your age, you rob yourself of one of the simplest, most powerful sources of self-connection. Worse, when masturbation is always done in secrecy, it can become associated with guilt or anxiety. That emotional stress takes a toll on your nervous system and hormone balance, especially cortisol and testosterone. Over time, this can actually reduce your sexual function and impact your mood and energy levels. But when masturbation is approached without shame, as a part of your well-being, it becomes healing. It boosts dopamine and oxytocin, feel-good chemicals, helps regulate sleep, relieves tension, and supports prostate health. It's not just okay, it's often good for you. So what can you do? Normalize it for yourself. You don't need anyone's permission. Remind yourself that your body still belongs to you and pleasure is part of self-care. Create a comfortable, respectful space. Don't sneak or rush. Treat it like any other ritual. calm, quiet, and without pressure. Talk about it if you want to. Whether with a trusted partner, therapist, or online support group, having honest conversations about aging and sexuality can be incredibly freeing. Let go of the guilt. If you grew up with messages that pleasure is shameful, recognize those as cultural, not truths. You're not doing anything wrong. You're honoring your humanity. You've lived through decades of noise, roles, and responsibility. You've cared for others. You've held it together. So don't deny yourself now. Your body is still your own. Your needs are still valid. And your pleasure, especially when embraced with dignity, is a quiet act of self-love. You are not wrong. You are not alone. And there's nothing shameful about honoring the life still moving through you.